So we will have a look on the silent symptoms of neuropathy, why it causes diabetic foot problems, and common ways that this happens in patients. The key thing with diabetic neuropathy is that patients are often asymptomatic, and this is because as the disease progresses, the less sensitivity you have. So in other words, the more advanced the disease is, the less you feel it. So the symptoms don't correspond to the degree of disability, and this is why screening is so important, because otherwise it may just go unnoticed. Sometimes it will only be acknowledged once it already caused further complications such as chronic foot ulcers and deformities. Neuropathy is the root cause of diabetic foot problems. Diabetic foot problems, they have a significant impact on quality of life and morbidity. It's the commonest cause of hospital admission among diabetic patients. It causes more lower limb amputations than any other conditions, and it causes more to the health system than breast, lung, and prostate cancer combined. So diabetes does not directly affect the foot, nor causes the skin to spontaneously break down. So recapping from what we saw earlier, congenital insensitivity to pain, it's just the same thing, that it doesn't cause the tip of the tongue to spontaneously fall off. What causes though is insensitivity to pain, so self-biting actually makes the tip of the tongue being lost. So in a similar way, what causes the skin to break down in foot ulcers is pressure. So for example, as we were talking about stepping onto a nail, what happens when you step into a pointy object is that the whole weight of the foot is concentrated on a tiny surface. So this imposes a lot of pressure in the skin because the weight is the same, but the area in which it is supported is reduced to a tiny surface. So the pressure in this area is increased enormously, and the skin cannot cope with so much pressure, so it breaks down and the object penetrates the foot. Similarly, ulcers only develop in points of trauma and pressure, which is sadly easy to happen in the neuropathic insensitive foot, as we will see next. So for diabetic ulcers to develop, there must be neuropathy plus some sorts of unperceived trauma. And common ways this happens is through direct damage, continuous pressure, repetitive stress, or walking on an injured foot. Direct damage is the most straightforward of them, the easiest to understand because it happens to all of us. For example, we don't step into a nail every day, but having a splinter is a bit more common, or just stepping into something pointy on a beach or getting a little rock on your shoes. And this is just more likely to happen to neuropathic patients because they cannot prevent it. So maybe as you're about to step into something dangerous in the beach, you may realize it and retract your foot before the harm even happens, or just realize you have something in your shoes and just take it off. But if you cannot feel it, you cannot prevent it. And it doesn't need to be anything too big, so even a small injury, if you continue to walk on it, it just gets deeper and deeper, so it makes worse at every step because you cannot feel it. So another way where ulcers develop is through continuous pressure. Low intensity pressures that would usually be harmless, so for example in a tight shoe, they may cause injury if sustained for prolonged hours, again because you cannot feel it. So you may just go with the same shoe the entire day, and by the end of it, pressure interrupts blood flow and causes tissue death. Another way is repetitive stress. So there's shear stress, which is caused by friction of the skin. Again, in most of us, it will not cause much harm, but if you cannot feel that and you just go through the entire day without checking your foot, by the end of it, you might have a pretty nasty ulcer. And also just through normal walking, really, if it's prolonged. So during walking, we put a lot of pressure in our foot, so we have the whole body weight, let's say 80 kilograms, in just a small surface area. So there's a lot of pressure, and as you are about to start to walk, you need to transfer the weight to one foot, so this even increases further the pressure. And even worse, if you look at the mechanics of walking, you are actually transferring it to just one small portion in the front of the foot, and then into the heel of the other, almost the entire body weight into such a small area. So we have this moment of high pressure in the skin, and this is when the skin is more likely to break it down if sustained for long enough. And a healthy person would not walk on an injured foot simply because the pain would be intolerable. It would be difficult to even put the foot in the floor, but the neuropathic foot doesn't feel it. So patients continue to walk over an injured foot. Even once they are already aware and educated about the importance of preventing pressure on it, they may just eventually forget it, or they will just do it anyway in an emergency, such as the toilet. And walking on an injured foot spreads infection, prevents healing, and ulcers become chronic. It's pretty difficult to heal neuropathic ulcer without specialist care. So if the infection reaches the bone and it cannot be controlled, it might be that the foot needs to be amputated. And that's, unfortunately, as we saw before, how most lower limb amputations happen.